Mesquite ISD is partnering with Project Atom and Cook Children's Hospital to implement a Heart-Safe School program on each of our campuses. This training is designed to bring self-awareness to staff regarding sudden cardiac arrest and the steps each person can take to save a life. These steps include the rapid identification of sudden cardiac arrest, emergency services activation, or 911, the initiation of CPR and rapid use of an AED, and rapid transfer to a high level of care to complete the chain of survival. There are about 350,000 sudden cardiac deaths in the U.S. every year. That's almost 1,000 a day. These victims could be on your staff or visitors to your school. At least 600 to 1,000 of these occur in children and adolescents each year. So we can expect that might be 10 to 25 student deaths in Texas each year. This sudden cardiac arrest is different than a heart attack. Let's look at those differences. A heart attack is caused by a clogged artery that results from lifestyle choices, like eating foods high in fat, not exercising, or failing to get blood pressure checked. Genetics may also play a role in a person's individual risk for a heart attack. These are some of the symptoms that an individual suffering from a heart attack might experience: chest pain, back pain, arm, neck, or jaw pain, or an upset stomach. The good thing is this person may be able to talk to you and tell you how they're feeling so you can call 911 and get them the help they need as soon as possible. Sudden cardiac arrest is different. It occurs when something interrupts the normal flow of blood through the heart. Typically, our heartbeats pump blood around our body 60 to 80 times every minute that we're alive. However, in the case of sudden cardiac arrest, the heart goes into ventricular fibrillation, or ineffective quivering, and the heart is no longer able to pump blood flow to the brain, and vital organs stop working almost immediately. This leads an individual suffering from cardiac arrest to drop suddenly, like the young lady in the video. Those lucky enough to have time to feel symptoms may describe feeling woozy, dizzy, or blurred vision. They may also experience some jerking movements or gasping respirations similar to a seizure. The key to saving a life in this situation is having a plan. This plan includes training all staff about cardiac arrest, naming first responders or individuals who are trained in proper CPR and AED use, learning the signs of early recognition, developing a communication plan, and always knowing the location of the nearest AED. Can't we just wait for EMS? No. Do you have time to ask lots of questions? You don't. You only have seconds to make a huge difference in someone's life. You have to respond immediately. Remember, blood flow to the brain and vital organs has stopped. Survival rates decrease by 10% with each minute of delay. Every person in your school setting who interacts with students should be prepared in the event of a sudden cardiac arrest. How do you know it's a sudden cardiac arrest? You don't. But when someone goes unresponsive suddenly, that should be considered a sudden cardiac arrest until proven otherwise. An AED will identify the need for a shock. It will not shock an individual who does not need it. It is much better to apply the AED and have it not advise a shock than to not apply it at all. So, if you suspect that an individual in your school is experiencing sudden cardiac arrest, what do? Follow your campus's medical emergency action plan. 1. Recognize the emergency. 2. If the victim is unresponsive, activate emergency medical services, EMS, by calling 911 or an SRO, if available, will contact via radio for secondary campuses. Do not move the victim unless the area is unsafe, and if other students are present, redirect them to another area of the building away from the emergency site. 3. Contact the front office. Give the location of the emergency and activate the medical emergency response team. The office will then make a PA announcement as follows. Attention all staff. To the site of the emergency. They will repeat this 3 times. 4. Upon hearing the announcement, MERT team members will pick up the nearest AED available and report to the location given. 5. Response team members will perform CPR and apply the AED as appropriate. MER staff who have classrooms with students should not leave their classes unattended. 6. To facilitate a quick transfer to EMS, someone from the response team will meet the incoming ambulance and direct them to the location of the emergency. 7. A pre-recognized staff member will print and provide the victim's emergency information and provide this to the EMS. 8. A pre-recognized staff member will contact a guardian and communicate the situation and EMS transfer location. 9. Once EMS has arrived and care of the victim has been transferred, the school nurse will notify the Director of Health Services. If the school nurse is not on campus, a campus administrator will contact the Director of Health Services. Here's an example of something that could happen at your school.
Hey, are you okay? Are you okay? You okay? Hey, I have a student down in the big gym. I don't think she's breathing. I need help. I don't think she's breathing.
Attention, all staff. All MERT members report immediately to the big gym. Attention, all staff. All MERT members report immediately to the big gym. Attention, all staff. All MERT members report immediately to the big gym. Attention, all staff. All MERT members report immediately to the big gym.
Hey, oh my God, what's going on?
Hey, I don't know. She just collapsed. She's not breathing.
Let me call 911. Yes, this is Agnew Middle School. We have a female student down in the gym. We've started compressions and the AED is on its way. You want me to take over?
Class, come on, follow me, hurry, follow me. Let's go this way.
19, 20. Okay, ladies,
When did y'all start compression? It's been about 2 minutes.
okay. 911 is on their way. I just called.
Front office, please contact the parent of Jane Doe for a medical emergency. They need to be on their way now. Do we need to go on hold?
I don't know, what time is it?
We're about to get into a passing.
Adult
We need to do a hold, go for a hold.
pad firmly on skin.
Okay, front office.
Do not touch the
doing good.
patient. Analyzing heart rhythm.
Keep going.
What can I do to help?
The EMS is en route. They should be at door number 9. Will you make sure we receive them so we can bring them in?
Okay, I'll let him know.
Shock
Okay,
advised.
shock, don't touch.
Do not touch the patient. Everyone clear.
Clear.
Shock delivered at 2:45.
I'm here to relieve you when you're ready to rotate.
Okay.
Give 2 breaths.
Okay, go, start.
Okay, paramedics are here. They're gonna take over.
Okay guys, you did really, really well. That was a great drill. So just to go over a couple things, you got here, we made sure the scene was safe. We got 911 on the way. We started CPR. The event was noticed at 2:35 p.m. You guys got your first shock in at 2:38, which was perfect. We want that to be less than 3 minutes. So you guys did really, really well. We also want to think about, in this case, we didn't need to use the Narcan, but if we hadn't seen what happened and they were just unresponsive, we would want to consider giving that Narcan in case it was a possible overdose. So I think you guys did great. Do you guys have any feedback for each other?
I think it's important that while we were in here, we were getting close to a passing period. So it's important that we went and hold. Me and Jasmine, our nurse, made the decision, but if I wasn't here, I want to make sure that anybody else can help coordinate what the scene looks like to make sure that the rest of the school is safe also.
Let's make sure that we're being loud and clear in communication.
We want to be sure and clear the parking lot so that the parents and the paramedics could be able to get in the building.
All right, that's a wrap, guys. Good job. Thank you so much for letting us come.
Many times children have already exhibited early warning signs of sudden cardiac arrest that went unrecognized and unreported. What are the early warning signs for sudden cardiac arrest in children? Fainting during or immediately after exercise is the biggest red flag that tells us there may be something wrong that needs to be evaluated. Other early warning signs include shortness of breath, fatigue, chest pain, or shoulder pain during or immediately after exercise. These signs do not necessarily have to happen in association with exercise or activity, but in children, it most often does. And when it does, it needs to be reported to the school nurse or guardian right away so the child can be evaluated by his pediatrician and possibly by a pediatric cardiologist. The last early warning sign is a known family history of cardiac conditions in children. Most of the conditions that cause sudden cardiac arrest are genetic. An important red flag in family history is whether there has been an unexpected or unexplained death before age 50. Even with a drowning or single car auto accident, there is always a possibility that a sudden cardiac arrest caused the incident. Others in the family may be at risk at having the same condition. Remember, in the suspected event of a sudden cardiac arrest, time is critical. It is important for everyone in the school setting to know about sudden cardiac arrest and how to respond. Hopefully, you won't ever encounter an emergency like this, but with the information in this video, you will have the knowledge and skills to feel more confident in your ability to respond and possibly save a life. Your campus nurse will provide you with campus-specific training and emergency plans. For further information regarding Project Adam, go to projectadam.com/heartsafeschools.